Hi, I'm Raina Morgan with iHealthTube, visiting with Dr. Cheryl Selman, an author and lecturer about women's health, and we've talked some about bone loss and menopause. Let's talk about the popularity of bone loss products. Movie stars are advertising them. You say there are side effects. What are some of those side effects, Dr. Selman?
Well, the classification of drugs that are the most popular are called bisphosphonates. So to understand a bisphosphonate, we need to understand when we clean the ring around the toilet, ring around the bathtub. And a ring around the bathtub is not dirt after a bath. It's skin cells that have sloughed off. So we often use some sort of scouring powder, right?
Mm-hmm.
And that gets rid of that grime. Well, the scouring powder is made up of a similar ingredient that dissolves skin cells. And that active ingredient is very similar to the active ingredient in these bisphosphonates. So when we take Fosamax and Boniva, these are bisphosphonate drugs. And how do we know that they're similar? Because the instructions clearly say when you take these drugs, you must not lie down for a half hour after taking them.
Right.
Now, why don't you lie down? If you lie down and you take these drugs and they sit in your esophagus, they will do the same thing to your esophagus that this ingredient can do to the ring around the bathtub. It actually will dissolve skin cells and cause ulcerations of your esophagus. That's not a good sign.
That's pretty toxic.
Yeah, that's not a good sign. If you know that something is eating away your cells, you better be aware. So that's what we need to first of all understand, that this drug will dissolve your skin cells. It's very toxic.
Okay.
So you sit up. And then when you take the Fosamax or the Boniva or these bisphosphonates, they actually go in and they stop a normal, healthy remodeling process of cells, old cells being dying and clearing out, and new cells being born. It literally stops this from happening. So because you cannot lay down new bone cells, it appears initially that you have no further bone loss. But it is not telling you the whole story. You have no further bone loss initially because of the fact that you've stopped this natural process. And when you stop the natural process, you will have long-term effects. In the case of bisphosphonates, and by the way, once you are prescribed a bisphosphonate,
yes,
you have to be on them for the rest of your life, you're told.
Right.
Rest of your life.
Right.
So they have you, right? So the longer you're on it. Now the studies were ended just short of the time that the results of the bone loss and the compromised bone health would have been noticed. So they were ended early, but if you're on them for a long term and for 6 or more years, you will discover that there will be greater risk of bone fracture because you're actually creating poor quality bone.
Okay.
And when you can't put down new bone cells and you just have these old cells there, you will be at much greater risk of fracture.
So the natural antidote to that would be, you suggest progesterone cream, correct?
Well, progesterone is the hormone that stimulates the cells called the osteoblasts that actually are the new bone cells, repairing and laying down new bone cells. That's the hormone that should have been studied, and presently there is a clinical trial underway with older women to see if progesterone truly will help increase bone density, which anecdotally it has. But that should have always been the hormone that should have been the focus. Estrogen will only stimulate the osteoclasts, and those are the cells that eat away the old, dead, and dying cells. Estrogen does not build new cells. Progesterone is the hormone that builds and stimulates new bone cells.
Well, those are great facts to know for women's health. Thank you very much, Dr. Selman.
You're welcome.